you were talking there about, you know, people working in more flexible ways and giving them then again that empowerment. That's obviously top of mind for a lot of folks now. As you know, hybrid ways of working is very topical for a lot of people. And in the main, what it's, you know, again, like activity-based working, you could talk at length about what is it, but, you know, in the main, there's generally, Australia is very similar to the rest of the world, is that there's a level of flexibility in general from staff and employees. They want a level of flexibility now and a level of empowerment that they didn't have pre-pandemic, and they want to be able to make choices. And of course, there's a range of different ways to approach that and so on. What you were talking about there was one of those things. Hey, you don't all need to come in at 9 a.m., right? If you have other life commitments, or you want to stagger things, better for New South Wales Health, right? Because it gives you more flexibility there, and it's better for them. So what has been your approach overall as you're the, you know, you're responsible for workplace experience now? What's been your general approach to hybrid, and how's that been working for you?
There's been a number of challenges. I think the main one that I think a lot of I guess people that look after, you know, facilities and sites is around safety for people. A lot of people have forgotten, and we've also had new starters, a lot of people that, you know, have just started with the business during, you know, the pandemic, and probably haven't connected with people as much, and understand, even from a practical point of view, if there was a fire in the building, where would you go? You know, where are the fire escapes? Yeah. So we've had to evolve a lot of things so that it's digital now. So we've got a digital e-learning session on how to, you know, whether, you know, when you hear the whoop, whoop and the beep, beep for a fire alarm, what do you do? Because a lot of people, if they haven't been in the building and they're suddenly in the building, so that I guess has been really important from a safety point of view. We've also created like a virtual online induction as well, so people know what to expect. We do continue our, you know, induction for new staff on site, physically showing them around the facilities, but obviously give people the option, if they don't feel comfortable with that, to do the virtual one. And so that's been really good as well, and people being quite responsive to that. I think it's about broadening our ways of reaching people. We communicate with people. The other thing that's evolved that's really helped us is just dashboards and data. Like, I didn't realize how interested I'd be in data as I am now, to give people ideas about occupancy or how people are connecting with us. You know, a lot of the digital screens now, we have a QR code linking to certain pages, so we actually can understand how effective things are. So I think that's something certainly pre-pandemic we wouldn't be so interested in, all this data. And now constantly, you know, you can't help people to change or help people or help make decisions when you don't actually have that data support. And I think that's been really important for us. Yeah.